Poison control centers are reporting an alarming number of calls about children being exposed to THC gummies. They say kids are getting sick after accidentally ingesting products containing THC and similar chemicals. But the Wall Street Journal reports regulators are grappling with how to contain it because many of these products, some of which are unregulated, derive their intoxicating compounds not from marijuana but from hemp, which is legal on the federal level. ABC News medical contributor Dr. Alok Patel is joining me now for more on this. Dr. Patel, this difference between marijuana versus hemp makes a difference from a legal standpoint. Does it make a difference from a medical standpoint if you ingest that?
Absolutely. So legally, hemp is going to refer to the same species of cannabis plants, but it has to legally contain less than 0.3% of the psychoactive compound THC. But it could potentially contain other compounds, and makers of these hemp-derived products could isolate these compounds. And remember, Diane, even a young child who doesn't weigh as much as an adult needs a smaller amount of milligrams of these products to actually feel an intoxicating effect. And when they're packaged like candy, chips, cookies, sour gummies, and they're accessible to kids, and they don't have child-friendly packaging, this is a setup for a problem. So
what happens if a child gets into one of these packages and eats part of this gummy or brownie or whatever it is? What are some of the symptoms to look out for?
Kids can experience nausea, vomiting, they can have diarrhea, they can have a fast heart rate, they can have breathing difficulties, confusion, in some cases with an excessive overdose, especially now if we're talking about products that have a higher amount of THC. We're moving away from hemp. They can even have mental status changes and seizures, and we see these kids wind up in the emergency department every single year.
So what should you do if you think your child may have ingested one of these products? Do you wait to see symptoms? Is that how you judge it? Or what's the first plan of action?
The first plan of action is prevention. Parents should understand that keeping these products away from kids, they don't always have child locks on them, so lock the products themselves. In one large study, the average age of kids who are getting these products winding up in the ER were 2 to 3 years old. 90% of the time, they found these products at home. So if you suspect anything, call poison control right away. If you notice any symptoms, you want to talk to a healthcare professional or go right to seek medical care, either in urgent care or the ER.
All right, good to know. Dr. Patel, always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.